and offer the other auxiliary services for this type of facility. The hospital that is designed should be able to have a minimum of 2,000 beds for inpatient capacity, and also offer outpatient services to the population. They also should offer specialized services for a tertiary care hospital across all specialized disciplines of medicine. Examples of these disciplines include trauma. So you should have trauma services. When you get injured, you have involved in a major accident, you go there, you should be able to get services. Specialized maternal and child health. Cancer care, that is oncology, cardiology, nephrology, and neurosurgery, among other disciplines of medicine. So it's a comprehensive facility. The other bit about the requirements for this facility, it should offer training and research.
This is Ikue Updates. Kama mbaya, mbaya.
The other bit about the requirements for this facility, it should offer training and research. So you should have teaching facilities aligned to this hospital in terms of universities. So now you have medical schools attached to it. So when you talk about now specialized doctors will be trained within Bungoma County. For us, we had to travel for long distances, stay away from our families, for us to acquire this specialized training. Now this training, the hospital that is proposed is going to offer those services within this county. And then there should be support systems for the hospital. In terms of, number one, you have blood transfusion satellites within the facility, pharmaceutical supplies, chain systems, modern diagnostic equipment. So all the equipment, whether you are talking about MRI, CT scan, PET scans, all those should be available within this facility. And you should also have an ICT-based hospital management system. The catchment area for this type of hospital should be able to serve the needs of the local community, the regional community, and across the border. So for us, the hospital should serve even the eastern part of Uganda, serve all the surrounding counties, whether from the North Rift, whether from the western region, or even beyond the greater Lake Economic Bloc. So that is a type of hospital that is designed. So what is the project status? The Level 6 National Teaching and Referral Hospital for Bungoma is going to be funded by the African Development Bank. And for this to be accelerated, we require greater political goodwill for it to start before the end of this year. You need a political goodwill. In terms of land requirement, we say that the World Health Organization requires 50 acres of land. So what is currently available within Bungoma County? Available is 39 acres. So the county government requires to procure an additional land, and that's around 11 acres, for us to meet this minimal requirement. Once you have this land, it needs to be owned. You need to have a title showing that we own the land. And that title will be surrendered to the National Treasury, because now it's a national government project. for it to be implemented. So what about the site? We say that this is a project that was conceptualized in 2022. The technical teams visited various areas. One of the areas that was visited was Bungoma County Teaching and Referral Hospital. Another area that was visited was the Kiwanja Ndege field here in Bungoma. The other area that was visited was in Bumula. And then the other area was Webuye, and then the KMTC grounds around Chwele. At that time, I think the Kiwanja Ndege had not been degazetted, so it was still property of the Kenya Airports Authority. And still, even when they added all the acreage, it did not reach the desired 50 acres. So the technical team, which were doing the assessment, settled on the Chwele site during the feasibility study. At that time, the funder required that you do coordinates. And they did the coordinates, which were submitted to the funder. So that is about the siting. About the expected catchment population, we expect that this hospital, once completed, will serve the Western Kenya, parts of Nyanza, Rift Valley, and the cross borders. So we expect people from Uganda, Rwanda, the Democratic Republic of Congo, Burundi, and South Sudan to come and access services within this facility. The expected economic and social impact of this project, that through the bank will give a 15-year loan concession with opportunities for real estate. So now the people of Bungoma have opportunities now to invest, because it's a massive project in real estate, also invest in medical training, food chain, and job creation. You can imagine a hospital that is going to serve 2,000 inpatients. How many doctors are those that will be required? How many nurses? How many physiotherapists? And all this population is going to come into Bungoma. They will need accommodation. They will need food. That is massive for the people of Bungoma. Political concerns, of course, there has been opposition from the neighboring counties, but it has been agreed that we can have multiple facilities. You can have facilities both in Bungoma and in Kakamega at the highest level, and they can coexist and provide services to the residents, and have people move across borders to seek for services wherever they need. So what are the next steps in terms of this project? Currently, the project is awaiting African Development Bank response to the National Treasury letter. And once that letter is received, there will be a feasibility study that will be done. And then after the feasibility study has been done and the project is ongoing, there will be a loan agreement. Then there will be an implementation team that will be formed. Then now the hospital will be designed about the type of hospital that we require here in terms of the outlook, the buildings. And then once that is done, they will be tendering. And then whoever will succeed, there will be a contract that will be signed. Then the construction works will begin. And once the construction works have been completed, then the hospital will be equipped, both with personnel and the medical equipment. And then the last step is now operationalization. So those are the next steps. The county government of Bungoma can make CSR requests to the African Development Bank. Some of these can be, number one, to strengthen the existing facilities so that you have a strong referral network. So you will have facilities within Chwele strengthened, facilities within Webuye strengthened, facilities within Kandui upgraded and strengthened. And also you can have the road network within the county strengthened so that for ease accessibility to this facility. So that can be a CSR request from the Bungoma County to the African Development Bank. What is the expected impact of this facility, of having a level 6 facility within the environments of Bungoma County? Number one, improved healthcare access. So you will have ability to provide high quality, specialized services closer to the people, reducing to the pressure on the other referral facilities. Recently already we saw Moi Teaching and Referral Hospital is saying it is overwhelmed. So this facility reduces pressure on those facilities. Now patients within this region can be served with this region, within this region. It reduces costs to the patients. So the patients don't need to travel for long distances. You don't need to hire taxis, vehicles to go for long distances to Eldoret. So many people die on the road. You can imagine, life is of essence. You have to travel for so many kilometers to Eldoret. I think it's about 129 for you to access services. And it is, your life probably, it's an emergency situation, it is time bound. So you will have this access here, including, we talked about cancer care, cardiology care. Me, I'm an emergency doctor. So if, for example, if you have a heart attack, you only have 6 hours to get to the cath lab. So having this facility here will shorten our distance. Economically, the project is going to spur growth in the real estate. We've said that not only for the workers who are coming to work here, even the whole hotel industry is also going to boom. Because some people are traveling from DR Congo to bring their patients to Bungoma County. They will need a place to stay. They will need, the staff themselves will need housing. They will need to eat. Economically, that is huge. There will be huge supply chains, people to supply drugs, people to supply food to this hospital. It's a massive opportunity. And local businesses will thrive. So we need to let our people know that there are immense opportunities that are coming to Bungoma. We've already talked about employment, but this hospital is going to create thousands, number one, of direct jobs. A lot of Bungoma County has produced major brains in medicine. They're out there. They're out there. Now we can bring these brains back home. If you talk about specialists in the best specialists in oncology, they come from this county. If you talk about gynecologists, they come from this county. All those people are going to come home and they are going to offer services to the people here. Then you also have indirect jobs. During construction, for example, people will get jobs to offer services during construction. You also have jobs after operationalization of this facility. We also expect advanced training. So we need to see that after this hospital is operationalized, there will be opportunities for research. That some of the innovations will come from Bungoma. That when you talk about advancements in medicine, you will say this one was designed in Bungoma, not China. This one was in Bungoma. So that hospital will offer that opportunity. Of course, the university like Kibabi will also have opportunity now to establish medical schools. So we'll have a proper established medical school within the Bungoma County. And of course we have the medical training colleges, the mid-level training colleges. They will also have an opportunity to offer care, to offer training. We will have many doctors coming from far wide, because once they come in for training, so we'll have doctors coming in to train in surgery. That doctor is qualified. So they will be offering services at home here. Number two, we will also have innovations. That also should also strive to offer innovations within the healthcare sector, so that you become an innovation hub, you innovate and now sell evidence-based practices to the world. Bungoma County will now serve as a regional integration. It's a hub. So we'll have all the other facilities now referring patients to Bungoma. So Bungoma will be a center of the medical tourism. When people talk about we want to go to India, this facility can offer an opportunity for people to come from all over the continent, all over the world, to get specialized services within our county. And the hospital is not just about service provision. It also provides security, health security. It is strategic. When we talk about we are near the borders, I think we've seen COVID, we've seen Ebola, all those. Now we'll have a center that can be able to respond to pandemics. Of course, we've talked about CSR commitments and infrastructure developments. For example, some of the benefits will be, we expect the upgrade of the Chwele, Kimilili, Kamkuywa, Mount Elgon, Bungoma road network to be improved for accessibility to the facility. So once you build the facility, there needs to be infrastructure accompaniment. so that people can now reach the hospital, so that the hospital is accessible. That now roads do not become a barrier to healthcare access. So this hospital will come with that benefit, that even apart from the healthcare infrastructure development, there will also be road network developments within the county. And then also we expect that there will be improved and modernized satellite feeder hospitals surrounding the referral hospital. So all the other facilities within Chwele, Webuye, Kandui, and all the other sub-counties within the county need to be upgraded, need to be modernized for them to offer service, and then now only refer patients who require specialized service. So that is also an expected outcome. Then in terms of politically and socially, this project is a flagship project, not only to the Bungoma County government, but also to the national government. So it is going to demonstrate, and the project is going to speak volumes about the leadership of this county, that they have delivered this project, and this project is going to transform lives. You cannot do anything without healthcare. This is huge, politically and socially. And to the national government, it demonstrates equitable distribution of healthcare resources. For a long time, this part of the county, this part of the country has not have proper healthcare facilities. I think this will be the first one. So this is a huge flagship project which all of us should support. So the project needs a collaborative and coordinated approach from all the stakeholders for it to be successful. It needs a whole of government and multi-stakeholder approach. We are grateful for the leadership, for providing leadership for this stakeholder forum. We believe that it will not be the last one. There will be more stakeholder engagements to enable this project to succeed. Number one, the county government of Bungoma needs to acquire the land, the extra land. It needs to do stakeholder mobilization. I think this is one of them. And also it needs an enabling environment that all of us as the stakeholders of Bungoma, we need to speak in one voice because this is our project. The national government, Ministry of Health and the National Treasury, of course they are providing policy direction, they are providing financing, they are also providing technical expertise, and they are also going to provide project oversight for the project to be implemented. The development partners, that is African Development Bank and others, they are going to provide financing, technical support, and they are also going to do the monitoring. The political leadership. We need to align all the political leadership across the counties in the Western region to ensure unity of purpose and minimize political contestation. So we need to mobilize that as a political leadership so that there is no There's no one who is saying probably this hostel should be here or there. This hostel belongs to the Western region. Then for the local communities, the local community needs to own and support the project through providing land support. The local community needs to provide land because this project is going to create jobs for the local community, and also the local community should accept the project. It's called social acceptance. Sometimes you go to a place, you want to put up a mortuary, and people say no. You want to put up a radiology unit, and they say no. So the community needs to accept the project. They need to believe that this project is going to help them. So we need to mobilize the community to accept this level of hospital. Then, of course, the CSR commitments in terms of integration of the nearby health facilities, that one I've already spoken about it, that we need to improve all the existing facilities and now integrate for them to be able to work together to provide services to the residents. Then, of course, road infrastructure, including all the roads within the county, needs to be improved for accessibility purposes to the facility. So in conclusion, the proposed level 6 national teaching and referral hospital in Bungoma is a transformative project poised to redefine healthcare in Western Kenya and the wider Great Lakes region. With strong political goodwill, intergovernmental collaboration, and support from development partners, Bungoma will host a state-of-art facility that meets global standards, improves healthcare equity, and delivers long-standing socio-economic impact. This project is not just about a hospital.
This is Ikue Updates. Kama mbaya, mbaya.
Na ikue.